Hi, welcome to my today's classroom. In my today's classroom, I will be discussing about a very common problem which comes in clinical practice that is known as irritable bowel syndrome. Now, this irritable bowel syndrome is an exclusion diagnosis. It is a functional disorder. In this functional disorder, the patient is too much troubled and there is a nuisance in his or her life. Now, this irritable bowel syndrome may be of mild variety, it may be of moderate variety, and it may be of severe variety. It is classified into four types. One is constipating variety, in which constipation is predominant. Other one is diarrheal variety, in which diarrhea is predominant. Third one is diarrheal and constipating variety, both as a mixture. That means there is sometimes constipation, sometimes diarrhea. And fourth one is M variety. M variety means in which you cannot determine the type. That is M variety. It is a vague type of irritable bowel syndrome. Now, these patients, why this irritable bowel syndrome develops in a person? Now, it is seen that in irritable bowel syndrome, motility of intestine is disturbed. Visceral hypersensitivity of the abdominal viscera, that visceral hypersensitivity is increased. Sometimes the irritable bowel syndrome is seen after infections, that is post infective irritable bowel syndrome, and because of repeated infections patient will develop this impaired motility and visceral hypersensitivity. Sometimes it is because of stress, and this stress factor is related with HPA axis, that is hypothalamus pituitary axis, adrenal axis, that is HPA axis. This motility is mediated through this HPA axis. So whenever there is a stress, then in that stress this HPA reflects HPA pituitary adrenal, that is hypothalamic pituitary adrenal axis, this gets disturbed and motility gets disturbed, visceral hypersensitivity increases. So, whenever a patient is having irritable bowel syndrome, motility of intestine is decreased. Now, it is seen that there are various reflexes in the GI tract which control the motility of intestine. When food enters intestine, some reflexes are elicited, some reflexes are inhibited. So there are various types of contractions and reflexes in the small bowel and large bowel. One of the one of the contractions is are known as DCC, that is discrete cluster contractions. Now, this discrete cluster contractions, these are the contractions which occur in cluster in intestine. This discrete cluster contractions, DCC contractions, they are increased in irritable bowel syndrome of diarrheal variety. Their frequency increases while their frequency decreases in constipating variety of irritable bowel syndrome. DCC in a normal person are specifically the contractions are normal. When these normal contraction decreases below a particular frequency, then constipation develops, and if it increases, that creates diarrheal variety. Sometimes these DCC, that is discrete contractions, cluster contractions, when these contractions are alternately disturbed, that is sometimes their frequency decreases, sometimes it increases, so again it will lead to irritable bowel syndrome of mixed variety. Then frequency of MMC, that is migrating motor complexes, this is again a type of contractions of intestine, migratory motor complexes. Frequency of this migratory motor complexes, gradually these motor complexes are developed, they contract in response to meals. So these motor complexes, migratory motor complexes, they go from one place to other, that is from They start from duodenum, then go to jejunum, then ileum, like this. So these are migrating motor complexes. When these migrating motor contractions frequency is increased above the normal, then diarrheal variety will develop. If it decreases below the normal, then in that case constipating variety of irritable bowel syndrome will develop. Then frequency of retrograde duodenal contractions. Whenever food enters the jejunum and ileum after in the post meal hours, the contraction of the duodenum decreases. Now, when this duodenal contraction and jejunal contraction they occur in a retrograde manner, that is backwards, then again this irritable bowel syndrome is produced and various symptoms of irritable bowel syndrome will develop. It is seen then that in patients of irritable bowel syndrome, the response to meal, the contractions in response to meals, in response to distension, ileal distension, in response to cholecystokinin, these contractions are increased. A small bowel sometimes it is in small bowel there is increase in the bacterial flora which is normally present in small intestine. Quantity of that bacterial flora is increased, it is changed, it is altered, that is known as small intestinal dysbiosis. So sometimes this small intestinal dysbiosis occurs in the irritable bowel syndrome, and because of that the frequency of contractions and the frequency of contractions of the bowel and the different reflexes they get disturbed. In colonic distension, one reflex is colonic distension and rectal distension. When fecal matter enters colon, there is distension of colon. When fecal matter enters the rectum, there is distension of rectum. So whenever there is colonic distension and rectal distension, the contractions of small intestine are inhibited. The contractions of duodenum are inhibited, and as a result of which patient is normal. But in cases of irritable bowel syndrome, the motility of small bowel and motility of duodenum is increased in the retrograde fashion as the fecal matter enters the large bowel and rectum. These are the inhibitory reflexes which arises from large bowel, that is colon and rectum. These inhibitory reflexes they get impaired in irritable bowel syndrome, and this change, that is alteration in these reflexes of the inhibitory reflexes, these are because of some chemical mediators, hormonal mediators which are present in the intestine. These hormonal mediators are prostaglandins, these hormonal mediators are leukotrienes, serotonin, then one is nicotine. This nicotine usually is increased in the blood level of this nicotine is increased in smokers, in tobacco chewers. So this nicotine, prostaglandins, leukotrienes, these are chemical mediators, these are hormonal mediators, they get altered, they get increased, their sensitivity will increase in the cases of irritable bowel syndrome. So these are all inflammatory mediators. These inflammatory mediators will increase inflammation inside the intestine, and will produce impaired motility, impaired immune response, and impaired inhibitory reflexes of intestine, as a result of which this irritable bowel syndrome will develop. It is seen usually in smokers and tobacco chewers. It is seen that whenever they smoke, their bowel motility increases and they will go for defecation. But in these patients, again, after smoking and after tobacco chewing, this stimulation will continue for a longer time and will produce impaired motility, impaired inhibitory reflexes, and whole of the motility and hypersensitivity of the intestine is altered, and the patient will develop symptoms of this irritable bowel syndrome. Then the visceral hypersensitivity. Again, this visceral hypersensitivity of patients of irritable bowel syndrome gets altered in cases of in irritable bowel syndrome, this visceral hypersensitivity is altered. Normal threshold of pain, it goes down when there is normally in a person, whenever there is distension of small intestine, whenever there is distension of colon, patient will not get pain because threshold is of a particular level. When this threshold comes down, then at the lower level of distension there is pain in abdomen. So these patients may complain of dull aching type of pain in abdomen only whenever a meal, whenever fecal matter enters the small intestine. So this is because of impaired visceral hypersensitivity, and this impaired visceral hypersensitivity, again this is mediated via prostaglandins, leukotrienes, and nicotinic receptors. These are all inflammatory mediators, serotonin, histamine, these are all mediators. So these mediators are increased in patients of irritable bowel syndrome. Sometimes in cases of post-infective irritable bowel syndrome, that is, symptoms like irritable bowel syndrome will develop in patients after intestinal infection, after an episode of diarrhea, after episode of cholera, after episode of acute food poisoning. So in these cases, this is because of altered intestinal flora. The intestinal flora gets altered, its quantity, that is the intestinal flora is increased in quantity. This is sometimes it is decreased in quantity. This is known as intestinal small intestinal dysbiosis. So because of this intestinal dysbiosis, because of this problem, patient develops irritable bowel syndrome in after infections, and this is known as post-infective irritable bowel syndrome. So whenever a patient comes with features of irritable bowel syndrome, always inquire about any episode of infection. Then stress, life stress, anxiety, depression, these are associated with the irritable bowel syndrome, and this is because of HPA axis, hypothalamic pituitary adrenal axis. This gets disturbed during anxiety, during depression, during various types of life stresses, and because of that, irritable bowel syndrome is precipitated. Now, these patients of irritable bowel syndrome, they present in with three types: mild variety, moderate variety, and severe variety. In mild variety, the life of patient doesn't get disturbed. He is only disturbed early in the morning or late in nights. In moderate variety of irritable bowel syndrome, sometimes in the mid of the day there is problem related to irritable bowel syndrome. While in the severe variety, whole of the work of patient, whole of the life of patient gets disturbed. So, clinically, we classify into three types: mild, moderate, and severe. There is one Rome's criteria, Rome's 3 criteria for this irritable bowel syndrome, in which they say that whenever you want to label a case as a case of irritable bowel syndrome, one, the features, that is symptoms of irritable bowel syndrome, must be present for at least 3 days per month for at least 6 months. Then only you can say that it is a irritable bowel syndrome. Plus, always rule out red flags, that is alarm symptoms. That is, if patient is having features of this irritable bowel syndrome, as I've already told you that this is a functional disorder, always rule out pathology in stomach, in duodenum, in small intestine, in colon, and then only you can label it as a case of irritable bowel syndrome. So if red flags are present, that is, if patient is presenting with bleeding, if there is weight loss, if there is dull aching type of pain in abdomen, dyspeptic symptoms are present, features of irritable bowel syndrome are present, then you can say that you will have to rule out the evidence of carcinoma, you will have to rule out other pathologies. So if whenever red flag symptoms are present, always rule out the carcinoma, and then after you have ruled out carcinoma, then you can label it as a case of irritable bowel syndrome. So this irritable bowel syndrome, as I told you, in motility is disturbed, visceral hypersensitivity is there, and HPA axis gets disturbed because of stress, and patient develops this irritable bowel syndrome. Now, these patients of irritable bowel syndrome, this is very common. Irritable bowel syndrome, it is present in about 20 to 25% of population. Usually young patients are affected. Of that, 70% are of female sex. So females are more affected with irritable bowel syndrome because their threshold value of pain is less. The hormonal levels of male and female, they differ. So it is somehow related to the female hormones also, irritable bowel syndrome. So it is more commonly seen in females than males, and that too young females. So whenever a patient of irritable bowel syndrome comes to uh, comes to a physician or gastroenterologist, always first rule out pathologies, various pathologies which are related to small bowel, which are related to colon, which are related to rectum, which are related to anal area. And once you have ruled out all these pathologies, then you go on the way of irritable bowel syndrome. Now, these patients of irritable bowel syndrome, they present with various dyspeptic symptoms. In one of my lectures, I have talked about non-ulcer dyspepsia. The features are similar to that of non-ulcer dyspepsia. These patients of irritable bowel syndrome, they will present with bloating sensation, they will present with gaseous distension of abdomen, they will present with feeling uh, of recurrent defecation. They will complain of post-meal diarrhea. They will complain of post-meal pain in abdomen. These are the features of irritable bowel syndrome. It is seen in irritable bowel syndrome, if it is of diarrheal variety, that is frequency is increased again and again. Early in the morning, patient has to go for defecation. In these patients, the motility is increased. They will have to go for defecation again and again. Usually it is seen with alcoholics and smokers, because in smokers, nicotine receptors, they get stimulated after smoking and after tobacco chewing, and whole of the motility gets disturbed. So frequency is increased early in the morning. Later on, in the with the lunch, frequency may increase, with dinner frequency may increase. That depends on severity of irritable bowel syndrome, diarrheal variety. One is constipating variety of irritable bowel syndrome. In this patient will present with pain, bloating sensation in abdomen, and constipation. And this constipation will persist for a long time. So these patients, if they are presenting with constipation, then you will say that it is irritable bowel syndrome of constipating variety. Sometimes you will get history of constipation for 2 or 3 days. Patient may pass hard fecal matter. Patient may pass sticky fecal matter. Only mucus is passed repeatedly. So in these patients, in constipating variety of irritable bowel syndrome and diarrheal variety of irritable bowel syndrome, sometimes there is diarrhea type of symptoms, increased frequency, sticky stool repeatedly, increase in mucus, and later on there is constipation. So, and this constipation may persist for 2 3 days continuously. Again, there is diarrhea. So, like this, these patients of intermittent diarrhea and constipation may be present. And then another variety is there in which there is only diarrhea, and then fourth variety is there in which symptoms are of vague type, dyspeptic symptoms are present. So these are the various symptoms of irritable bowel syndrome. So whenever a patient is presenting with irritable bowel syndrome, that is exclusion diagnosis, and this should be labeled only after excluding pathologies. Now, in this irritable bowel syndrome, one thing should be kept in mind, that is history is to be taken in a proper way. For food intolerance, for a particular food, sometimes patients are intolerant to a particular food, and the irritable bowel syndrome, that is motility gets altered, visceral hypersensitivity is there when a patient takes a particular food. Sometimes patient is intolerant to lactose. Sometimes patient is intolerant to rice. Sometimes patient is intolerant to wheat. So various food materials may precipitate irritable bowel syndrome. So if a patient comes with irritable bowel syndrome, always go for food tolerance test. This food tolerance test can be done by with the help of serology. This is a serological test, and in the serological tests, various the level of IG, IgG antibodies are seen in the IgG antibodies. G variety is seen in the serum against particular food material, and that is marked out. So if patient is intolerant to that particular food, he will have to eliminate that particular food from the diet. Sometimes patient is allergic to particular food, then also irritable bowel syndrome is precipitated. So if patient is allergic to particular food, then allergy against that particular food should be marked out. So this is irritable bowel syndrome. Is this in this particular syndrome, this requires uh, wide wide type of studies for proper diagnosis. Whenever you want to label a case as irritable bowel syndrome, one thing should be ruled out, that is celiac disease, celiac sprue, and tropical sprue. In celiac sprue, you will have to rule out the celiac sprue with the help of serological test, with the help of duodenal biopsy. Once you have ruled out celiac disease, then again you can label it as a case of irritable bowel syndrome, because in celiac sprue also, after taking gluten or gluten type of diet, wheat diet, then in that case such type of symptoms similar to those of irritable bowel syndrome are precipitated. So one should rule out this uh, celiac disease. Apart from this celiac disease, you will have to rule out tropical sprue in tropical countries. Tropical sprue may present in a similar way, and if it is a tropical sprue, then in that case you will have to do small intestinal biopsy to diagnose it as a case of tropical sprue, and then you will have to give continuously tetracycline for few months to control this tropical sprue together with the folic acid. So, celiac disease, tropical sprue, and lactose intolerance, fructose intolerance, these all should be ruled out before labeling a case as this irritable bowel syndrome. And sometimes this irritable bowel syndrome is precipitated by these conditions. So, almost there is a mixed type of pictures with these disorders. So, in order to do workup of this diagnostic workup for this irritable bowel syndrome, first thing is you will have to do upper GI endoscopy. After upper GI endoscopy, you go for colonoscopy, you go for enteroscopy. Enteroscopy means this is a endoscopic visualization of small intestine. So rule out each and every pathology with the help of endoscopic and endoscopes, with the help of endoscopic diagnosis. You go for serological diagnosis for various conditions like celiac sprue, for food intolerance, for lactose intolerance. You go for lactose tolerance test, fructose tolerance test to rule out all these disorders. So these are the investigations: fructose intolerance, lactose intolerance, endoscopies. Then you will have to do serological markers for cancer. Go for serological markers for cancer. You see the carcinoma markers of carcinoma of intestine, colon, stomach. If you have ruled out all these possibilities, then you label it as a case of irritable bowel syndrome. Now, once you have labeled a case of irritable bowel syndrome, you first ask patient to have lifestyle modification. Avoid this junk type of diet and avoid life stress. Do regular exercises, brisk walking, swimming, relaxation exercises like yoga. This will help a lot in irritable bowel syndrome. Take more of fibrous diet which is containing fiber. So this will help a lot in irritable bowel syndrome. So lifestyle modification, then dietary modification will have to be done in irritable bowel syndrome. Ask the patient not to take the street food which is prepared in dirty hotels or in hygienic condition. This can precipitate infective irritable bowel syndrome, and it will further increase the problem. So dietary modification, lifestyle modification is must. Then patients of this diarrheal variety are given fiber preparation, Isabcola husk with lactulose so as to control the constipating variety of irritable bowel syndrome. If it is a diarrheal variety of irritable bowel syndrome, you can use loperamide or you can use atropine sulfate. These are the drugs which are used to decrease the motility of intestine. If it is of constipating variety, sometimes you may have to give enema. You will have to give suppository if it is of moderate to severe degree. Laxatives will have to be used regularly in order to control constipating variety of this irritable bowel syndrome. If patient is suffering from anxiety, if patient is suffering from depression, if patient is suffering from life stress, then we will have to take support of psychiatrist. You will have to give anxiolytic drugs. You will have to give antidepressants in order to control depression and anxiety. So once anxiety and depression is controlled, then a patient can have relief from these symptoms of irritable bowel syndrome. One of the recent drug which is known as Lubiprostone is now in the market. This Lubiprostone helps patients of older age group, more than 65 years of age. This lubiprostone can be given in those patients in constipating variety of irritable bowel syndrome. This is a channel 2 activator, and this channel 2 activator is nowadays useful in irritable bowel syndrome, which is seen in patients over the age of 65 years. Then one drug again is in the market which is known as linaclotide. This linaclotide is useful in young patients. Apart from this, you can use rifaximin for a longer period. Give rifaximin for at least 10 to 15 days and then continue in low doses for a long time. You can use probiotics for a longer period. So this is how we can control irritable bowel syndrome. Now, whenever a patient of irritable bowel syndrome comes to you, whenever a patient of irritable bowel syndrome comes to a physician or gastroenterologist, first thing which affects that particular patient is personality of doctor, way of talking of doctor. If doctor is irritable, if doctor is in anxiety, then these patients they not get satisfied. Each and every answer of question of the patient will have to be given by the physician, by gastroenterologist, so as to convince these patients. So the way of talking, way of interaction of doctor helps the patient a lot, apart from medicines. In medicines, prokinetic agents are used in order to control the symptoms. So symptomatic control is to be done by symptomatic treatment. So this is all about irritable bowel syndrome. I hope this may help in your practice, and this may help medical students and the postgraduate students students who are preparing for entrance exams for this postgraduate studies will be helped a lot. Thank you.